Hey everybody, I'm Dr. Brett Smith. I'm an internal medicine and rheumatology physician. I'm the physician at Tennessee Direct Executive Health, and I wanted to spend a few minutes today talking about our executive health program. So are launching this in late 2024, early 2025. We've designed this program as an executive health program for a few reasons. We're pretty excited about it because it's a very comprehensive, proactive, accessible program that is personalized to you. And one of the things that we're really excited about in our executive health program is it's geared towards a number of different health outcomes that are data backed as well, but really it's our physician access too. So in this model, we are actually really promoting the idea of physician access. And what that looks like is that we are focused on very much breaking down barriers for access. So in terms of phone calls too, you have the physician's email, you have my email, you can text me. I get back to you the same day. Sometimes it's within minutes, sometimes it's within hours, but very accessible too. If you need an appointment, we typically can do that day. At different times during the day, we can do the next day, we can do the same week. So we have a lot of access options. Obviously, of course, in this too, we do comprehensive history and physicals as well as a part of that too. And one of the best things about the program is that we offer 25 office visits in the program per year with no copays. It's built into the fee schedule that we have, so you can come see us probably as many times as you need through the year, whether that be a handful of times or a couple dozen times, and you don't incur any additional fees. On top of that too is that we're really focused on a lifestyle medicine approach too, so definitely we use medications when they're indicated, but also we use a comprehensive lifestyle approach. So we're very concerned about nutrition, about supplements, about exercise, and then a very preventative approach as well too. We're concerned about emotional and spiritual health, so we're really addressing the entire person in this program as well. We also offer body composition analysis too, so instead of just using a scale, what we're looking at is a body composition analysis, and that'll tell us about your skeletal muscle mass, it'll tell us about your basal metabolic rate, it'll tell us about your body fat or percent body fat, and we can help sculpt that and track it over time to give you a better approach as well. On top of that too, we do VO2 max testing. So VO2 max testing is one of the best predictors of longevity from a cardiac or heart health standpoint in the literature. So we do the testing in the office. We can do that testing twice a year. I can also build programming for you to help you improve your VO2 max or sustain your VO2 max depending on where you're at. But we can help you with that goal because of the durability in the literature about how that impacts you and how well you live long term. On top of that too, I'm a certified personal trainer with the International Sports Science Association, and I do strength and plyometric programming for people too. We use True Coach software, and so I actually will build programs for people that are interested in improving either strength, stability, power, all these things that are important in the health science literature for health span and improving the quality of your life day in and day out. I also do cardiorespiratory program as well, so if you're interested in becoming more fit from an endurance standpoint, an anaerobic standpoint, like sprinting and such too. I can write it for running, and we can write it for swimming, we can write it for cycling or rowing as well too. On our assessments and our scales too, we also focus on resting metabolic rates too. So we have a machine that actually helps us understand how much gas and oxygen and carbon dioxide you're breathing out. It can tell us how much energy you have, demand you have during the day, and help us get an assessment of where you're at to help us kind of sculpt in that nutrition plan as well. We also are very big into nutrition. We believe that nutrition is a huge deal for health span and longevity and a lot of people's symptoms in terms of their outcomes, in terms of heart health and brain health and immune system health as well. So I'm an ISSA certified nutrition specialist as well, but also as a rheumatologist and internal medicine physician. I have a particular interest in nutrition as well. So not only do we go over your nutrition and can do specialized testing for vitamin and mineral deficiencies and making sure you're adequately repleted, I can also build programming too. We use what's called Eat Love software here. We use Eat Love software to personalize a nutrition prescription and help you plan to achieve your goals as well. We offer CGMs or continuous glucose monitors in office, and those help us to track about your symptoms and see if you're having any issues related to high or low blood sugar, see how you react to certain foods too, and give you better data about what's going on with your insulin and your pancreas and your hormonal system as well. We like to say that this is an accessible system for a year. So if you participate in our program for executive health, you get healthcare access with us for 1 year, and it includes all these things. This also includes communication with inpatient and outpatient teams. So if you're coordinating with a cardiologist or a lung doctor or a kidney doctor, or you're hospitalized, we can definitely coordinate with those teams as a part of our program as well. One of the programs that we offer here too is that we do a lot of screening for cardiovascular health and malignancy or cancers. And so we actually screen through a test that we offer in-house once a year for over 50 types of cancers in-house. So we can do that test. It's a blood test too. It's included in the package, and we can check for over 50 different types of cancers. Many currently do not have screening recommendations or options, so we're doing a comprehensive cancer check as well. We also do exercise stress tests in the office too, so we can put you on a treadmill and we can see if there's any cardiovascular problems. We'll have a cardiologist overread those tests as well after I read them to double check us. But that's a part of our program. We include your basic and comprehensive blood work as well every 3 months in the program. We do an EKG as well, and we have an imaging contract too that we actually do routine imaging to help assess for anything preventatively. So we'll do a once yearly chest x-ray. We'll also do carotid ultrasounds. We'll do a thyroid ultrasound. You also have the option for a CT calcium score to check for any sort of coronary artery disease or equivalents, or a low-dose CT scan for lung cancer screening as well. We include an annual food sensitivity test, and we'll do a comprehensive hearing test as well. So there's a lot built into this package too. It's a high-value system. It's comprehensive. We're looking for people that are wanting a very proactive and personalized approach to their health care. And so we've built this executive health program at Tennessee Direct, and we're super excited about it in Knoxville. And so check us out at www.tnexecutivehealth.com, and we'll see you next time.